everyone, Dr. Galyardt here, and I'm going to explain what a brain map is. A brain map is a quantitative EEG, just like an EKG of the heart, where we're sensing the electrical activity of what's going on in the heart, we're sensing the electrical activity of what's going on in the brain. And as we do that, we're able to record that raw data. We upload it to a normative database, over 160,000 brains. They look for what that normal brain should be doing, that consistent brainwave for that same age, same sex, and what that person's brain should be doing. And if it's too high, we'll get information on that. If it's too low, we get information on that. We do an eyes closed as well as an eyes open map. Two reasons that we do that. The eyes closed is going to tell us, can that brain shut down like it needs to? Is it able to relax, shut the eyes, able to calm itself down? Second one is when we open the eyes, we should go up a little bit, 20–30%. There's more stimulation coming in. We should be able to tell, are we in bigger surroundings? Is there more movement? Things like that. Some people, that jumps up a whole lot. So they get overwhelmed easily, overstimulated. When they go home, they've got to go into their closet and hide. It's just very, very overstimulating for those people. So we can tell a whole lot looking at that eyes closed and eyes open. So the brain map is a non-invasive procedure. We're not putting anything into the brain. All we're doing is detecting the surface electrical activity of what's going on. This is actually the cap that we use here. It has a cord where we plug into the computer that monitors it. Inside, we have all the electrodes. The electrodes are going to be sensing with some gel that we put into each one of those sensors. It's going to be sensing the electrical activity of each of those areas. So very simple to do, and we get a lot of good information out of it. When you look at the last time you've been to a psychiatrist, psychologist, your medical doctor, anybody, and to figure out whether somebody has ADD or depression or anxiety or any of these things that they want to put you on medication for, were you given an MRI, a CAT scan, a brain scan, any type of evaluation like that to determine what's going to be the best medication? No. All it is based on symptoms. We don't base things off symptoms. We don't have an ADD protocol. We don't have an anxiety or depression protocol. We go off of the brain map, and we go off of what is this person actually doing inside of that brain. Is it way too high in this area that can cause anxiety? Is it way too low that can cause depression? If it is, we're going to be able to teach that brain to do something different. So as we start looking at that brain map, it gives us really that guide for where we need to teach the brain to do something different. And as it looks and it makes sense to what the person is experiencing, then we know that we're on the right track and we can train that brain to do something different. So very important, there are a couple things that you really need to pay attention to. No caffeine, no medications, no Ritalin, no antidepressants, anti-anxiety, anything before doing the map. We're going to do the map in the first 2, 3, 4 hours of waking for most people, and that's when the brain is most fresh. If we wait till 6 o'clock at night, your brain's going to be fatigued. You're going to have been in the work setting or school setting, whatever it is, all day, and your brain's going to be a little bit more fatigued. So we've got to be able to have it boom right in the morning, and then we'll be able to retest down the road with the same parameters. So no medications, no caffeine, no coffee. You can have it if you're addicted to coffee and you need it, bring that cup with you and you can have it as soon as we're done taking a map. No hairspray. So we've got to be able to make good connections to the different places in the scalp. So no hairspray, gels, things like that. If you need to go to work afterwards, bring some of those products and you can use it in the bathrooms here. So we're going to need to come in, make sure you've eaten something, make sure that blood sugar stabilized, no medications, no hairspray, no gel, and we're going to get that very good information, that feedback of where your brain is. And it takes maybe 20–25 minutes at the most to go through this process. Very simple, you don't feel anything, non-invasive. We get that information, we upload it, and then boom, we know whether we're going to be able to help you or not and bring you into our program. So if you have any questions at all, let us know. Otherwise, we'll see you at the brain map.